move forward from there. So again, just making sure that you don't stray off of that page while
What
you're
you mean log?
who, who's speaking. I'm sorry.
It was Jordan. I asked, what did you mean by
Oh,
log?
sorry. I just couldn't see who was so before we took the quiz, when I said to make sure that you don't stray off of the screen while you're taking the quiz, we can see if you did. So that's what I meant. Sorry.
I
I'm being
do
more
want to
specific.
say the people with MacBooks, like if somebody was to call us, it would exit off the screen.
Call you
Yeah,
on your notebook. Is that what you're saying?
yeah,
Like,
when you're on Zoom, when my camera went out earlier, somebody was calling me. So
Okay.
that's why my camera went out.
Okay. Is there a way to block it?
I
no,
mean,
Mhm.
you can put it on D and D,
not
but if they're in
desired.
your close favorites, it's still gonna come through. And if they call 2 or 3 times, it's still gonna come through.
All right. So there's something else I was going to say. I can't remember what it was. All right. So today we are going to do, again, we're going to do week 7 and 8 today. Um, so for week 7, oh, actually, I remember what I was going to say. Who did the practice questions that I submitted through the announcements? How did those go? Do okay? Are they so helpful?
I did a few of them. I think they're helpful.
Okay.
I think they're helpful.
So I tried to, this time I made sure to put the
I
rationale in
do.
there. Good, good. So that you guys can see the rationale for the answers as well. So all right, so week 7 is kind of, where do you want to work? What do you want to do when you graduate from nursing school? So it covers chapter 18 in your textbook. So workforce trends, that kind of thing, how to find the right fit for what you want to do when you graduate from nursing school. And I know that we talked about this kind of at the beginning of the term, right? What you guys want to do when you graduate, where do you want to work? And everybody had a pretty good idea of what they wanted to do when they go out into the nursing world. So I will share my screen. All right. Get rid of that. All right, so I can see the chat. Okay. So where are some places that you can work? Okay. So long-term care, assisted livings, independent livings, school-related, home health, mental health, hospital nursing, of course, as well. There's also military service. I don't know if anybody has thought about joining the military when they graduate from nursing school. But that is an opportunity that you have as well. There's also, oops, come on, there we go. Outpatient clinics, doctor's offices, urgent cares, chiropractic offices, Veterans Health Administration, hospice and palliative care, private duty nursing, health insurance, travel nursing, the coroner's office. I always thought that would be really interesting to work in the coroner's office. Um, Pharmaceutical sales, and of course, there's always, agency nursing and travel nursing that is available as well. Um, and so it's just kind of finding the right fit. I will say for um, like your health insurance companies, they do hire things like health coaches, and getting some experience under your belt before you try to apply for some of those positions helps. Um, but it's just kind of finding out where you want to be. I will tell you that, and I know a lot of people don't. Um, don't enjoy long-term care. However, there is going to be a huge need for nurses in long-term care settings just because of our aging population. So, that baby boomer generation, they're going to need more transitional care. There's going to be a large, either home health or explosion in long-term care as well. And there are not enough geriatric prepared nurses that are working, and you can see that as the trend. There's a lot, it's like long-term care has been my passion. And it's a revolving door. A lot of people don't want to stay. They go into long-term care and they want to make a difference and they want to help, and they get burned out really quick in long-term care because it's hard work, right? And a lot of times, it's, short-staffed, things like that. So, um, let's see. So, personal attributes. And so you've done your professional development plan. What are some things that you learned about yourself when writing your professional development plan? Anybody want to share? No, nobody wants to share. All right. Being empathetic, right? That is one. Um, Having a genuine concern about the client that we are taking care of. um, Emotional stability in stressful situations. And how many of you feel confident in your abilities to deal with stressful situations? Whether it's in a long-term care, in a hospital environment. We work with not just our clients, but we work with other members of the healthcare team, and family members. So working in, stressful situations, we are going to deal with patients on the best days of their lives and some of the worst days of their lives, right? And being able to handle those situations appropriately are going to be necessary. And I know and I'm almost done, I have a couple more to grade. And as I was grading some of your papers, I noticed that some people are not comfortable with emotionally charged conversations, right? So what are some things what is some advice that we can give to someone when dealing with people in emotionally charged situations? What's some advice that we could give? I know
Maybe
it's a
have
tough one.
patience and
Oh,
empathy.
okay, always showing patience and empathy. What if somebody's yelling at you?
Stay calm and you don't have to yell back.
Stay calm, don't yell back, right? Sometimes just having that nice calming presence, right? Lowering your voice, right? If they're yelling at you, you don't want to yell back. It does take practice. How many, think about it, a lot of us, and myself included, and I've had to learn this over the year, when somebody's yelling at you, what's your first inclination? Is to yell back, right? So, and I'm a New Yorker, so, that's something that it took me a long time because, just generally New Yorkers are loud anyway. And so trying to refocus. Good observational skills, critical thinking and decision-making skills, right? Recognizing those subtle changes in your clients. Being able to, look at trends in their vital signs, or even just recognizing that something is just not quite there with your client. Um, Comfort level and your skills within your scope of practice. Skills are super important. The more practice that you get with the skills, the more better able you are to master those skills. And then depending on where you work, and what you do within, your scope within that, within that position, right, is going to, you're going to hone in on certain skills, versus other skills, depending on where you're working. Of course, following physician orders, assertiveness and client advocacy, remembering the difference between that assertive communication and or being assertive and being aggressive. Yes, Tevi. Do you have a question? Where'd she go? There
Sorry,
she is.
I had to unmute myself. Just how you were speaking of like where we want to work in the future and skills. I know as an aide, I've done long-term care, the longest, I guess. And I hear a lot of nurses in long-term say that they end up losing some of their skills or they forget some of their skills because they don't use them as much where they work at. So I feel like that's something important.
And that is something that is, you're absolutely correct. And so and I will say I'm gonna stop sharing for a second. I will say, so when I first started in long-term care, we started IVs, we drew our own blood, we had trachs, we had tube feedings, I mean, at one point we called our unit a mini ICU because we had very high acuity patients. Um, and it's changed over the years. And so now, which I'm not sure I like it, but we don't start our own IVs. We don't draw our own blood. There's a lab service that comes and draws blood. There's another service that comes if we need to have an IV started, that they will come and put the IVs in. And, of course, they can even come in and, insert PIC lines and things at the bedside now. Ultrasounds, x-rays, all of that are all contracted out to companies now. So if something needs to be done, very rarely are we performing any of those skills. So it is rough in some areas, that, depending on where you work. Now, like I haven't had a trach patient in years. So whereas I feel comfortable with trach skills, right, with suctioning and clean, and trach care, I haven't done it in years, but we've had other things, which, is interesting. We had one that had a pleurovax, so we did that, drained that, every shift. So no, it is true. And then, even other areas, think of like who wants to be a mental health nurse? Anybody? No, no, nobody wants to do mental health. Okay.
I want to
But
do mental health.
go ahead.
I want to do mental health.
I knew somebody wanted to, and I was can't remember who it was. And, that might be another area too, where you may lose some of your skills depending on what you're doing, because, it may be the same situation. They may just have mental health issues and not have any medical conditions associated with that, right? So there may not be a whole lot of, skills that you may perform. But with that being said, most places will have some sort of like an annual skills fair, that you can attend, that can assist you in maintaining your skills.
Or being PRN somewhere where you can like if you pick up or whatever you could stay fresh on. I know one of the nurses recommended that like it's good to be PRN, like it's good to be PRN and then part-time somewhere else, something in that nature.
Right, to have like one place where you may use a lot of skills and in
Yeah.
another place that you may not have. Yeah, and there's, and like we're saying, the opportunities are, and there's so many opportunities for LPNs now. So, and then practice makes perfect. Just finding ways to hone in on those skills and to keep them up to date, I guess would be the best way to say it. Um, Other qualities. So we're kind of going to go through like, what are some things that are beneficial for each one. So home health care, so home health care is a little bit different than working in a facility, right? Where you have all your resources with that's at that facility, right? Especially in a hospital setting. There's, everything you can, well, not everything, but just about everything that you need to take care of your patients, right? Within that hospital. Working in home health, right? That's a little bit different situation, right? Um, being flexible because unlike the hospital, you are now going into somebody's home, right? And so, you're not going to have equipment readily available should something happen. Even learn, I finding ways to clean equipment, making sure that it's being used appropriately. Of course, assignment changes based off of client needs can occur. And you may be at at a house visiting a resident or visiting a client. That RN's might can not be with you right then and there. Your nursing assistant may not be right there and then. So, you're still going to have that open line of communication, right, to make sure that the client is taken care of. You need much or not much. You need really good communication skills. Um, Working and, adapting their environment and learning what their needs are, being able to express yourself clearly, tactfully. We may have to also, think about, what's the educational level of our clients, making sure that we're using terms that they understand. And even sometimes, using words in the client's vocabulary. So for an example of this, when I first started in long-term care as an LPN many years ago, um, I had a patient. I can't remember what the conversation revolved around. But she, was talking to me and she said, or I think it was something to do with why she didn't eat her lunch or something along those lines. And she says, "Oh, honey, I have the sugar. I can't eat that." And I did not have a clue what she was talking about when she said she had the sugar. And um, I was like, "What sugar?" I'm like, "There's no sugar on your tray." Like I had no clue. I felt really dumb. Um, and she goes, "No,
Diabetes.
yes, diabetes." But she just kept saying, honey, the sugar." And I was like, no, I like really didn't understand what she was saying. And so I felt really dumb when I finally realized that she was talking about her diabetes. But these are terms, right, that you may have to, use in order to deal with some of your clients, in dealing with them in their own vocabulary. Home health nurses, you have to have self-confidence as well. If you don't have confidence, if you don't portray confidence to your clients, right, they're going to pick up on that. They're going to pick up on that insecurity. And so that's where, having your knowledge, your skills, are really going to play, a huge part in that. If you are, have any questions, you need clarification or something, wait till you're not around the client to ask the questions, call your RN, call your supervisor. You just don't want to do anything that's going to make your clients uncomfortable. You have to be sensitive to physical and emotional changes, right? So you're the one after that initial RN assessment as LPNs, you in home health, you're going to be the ones that are going to be spending more time with those clients, depending on how often you're going out there. So you're going to, you're going to be the one that's going to have to pick up on any of those subtle changes in their status. So you need to have those really, really good observational skills as well. The ability to deal with emergencies. And so being able to stay calm, to follow pre-know policy and procedure, and, to take it to the next steps, whether it's, having to call 911 or, providing emergency care right then and there until help can arrive. And then being non-judgmental. And this is one thing that you have to do, especially when you're working in somebody's home. That is their home, it's not ours, right? And we are going into their homes to provide a service. And not everybody keeps a clean, clutter-free home, right? There are hoarders out there. There are people that, maybe either don't see the value in keeping a clutter-free home or a clean home, or they don't have the physical ability to clean their homes. And so, this is just something that you need to be aware of. As long as it's safe for that patient, that is the key. And so, making sure that, any equipment that needs to be used is available and safe, that there's, a safe path to the bathroom, that there isn't anything dangerous, I should say. But that is probably one of the big things when working in another person's home. I did when I did my bachelor's program, I think I told you guys I spent the week at the health department. And one of the days I spent with the diabetic educator, and she did home visits. And I don't remember how they got referred because that was a really long time ago, but I remember, and nothing bad happened, with the visit. There wasn't anything negative that happened. But I just remember feeling really uncomfortable going into strangers' houses, and, trying to like provide care and things like that. So that's another comfort level that you have to think of if you want to do home health. Mental health nursing. Well, I already talked about mental health nursing. But things too with mental health, you have to kind of um understand some of, the behaviors that are associated with some of those psychological disorders, right? How to recognize them, um, how to pick up on the changes in their behaviors, being very calm, being able to make really quick decisions, have really good therapeutic communication skills, being non-judgmental, right? Respectful. The big thing with mental health is the ability to set those boundaries, right? So, being able to be assertive and set those boundaries, because a lot of your mental health patients we know can be very manipulative, right? Especially after a long-standing diagnosis of a mental health disorder. So, and then, how to handle more of those aggressive type behaviors. So it's, kind of everywhere you work, you're going to develop your skills in that area, which may, like, we were saying, you may lose some of your skills. At the same time, you might build other skills depending on where you're working. And you may not find, your dream job right after school, right? You may have to start in one place and then network as you're building your, wherever you're working, you're gaining experience, you're learning new skills, you're learning how to prioritize and work within the healthcare system. And that can then, as you build those skills and you start to network with other nurses, right, that can open doors to other experiences. So another part of this chapter is your personality type. Has anybody ever paid attention to what their personality type is? It's kind of like, have you done a learning style inventory, right? So I'll share my screen again. So when we look at personality types, so we have the analytical type. They are highly detail oriented. They can make difficult decisions without all the facts. They're perceptive. They also tend to be more pessimistic, right? So the glass is empty, half empty type people. The driver type tends to be blunt. They're objective focused, they're a hard worker, they make quick decisions, they're independent, they're the can-do person. They're also a tendency to be assertive, distrusting, impatient, high energy. They're also tend to be motivated by external recognition. The amiable type, they like to be liked. They're easygoing. They're not a big risk taker. They like to blend in. They're also very highly sensitive. They have difficulty making firm decisions. They also can be quiet and soft-spoken. And then the expressive type is a natural salesperson and storyteller. They are good motivators. They tend to exaggerate and leave out facts and details, and more relationship oriented. So, being able to recognize different personality traits or types around you is key, or it's a plus. And so you can kind of, develop skills to recognize the different types. But we also have to, how do we work with once, nice to identify ourselves, but we also have to be able to recognize these in the patient or in people that we are dealing with. So, with our analytical type, because they're detail oriented, they're also very perceptive. And so, you just kind of want to, speak to the point, right? They want just the details. Your driver type, they might, give them more highlights, right? They want they're impatient. So we just give them the highlights, speak deliberately. The amiable type, they want to have more of a friendly conversation, like, how is everything going? They want to be liked. So they like the small talk. And then the expressive type, they may also start with some small talk as well. But then, if you're giving information, you can provide little information and then leave opening for them to continue to speak. Oh, I'm sorry, I didn't hit the slide. So there you go. Potential references. So this is something too that you should start to think about while you are in school now, especially if maybe you haven't had a whole lot of employment prior to going to school. And some people, may have just come right, and come from high school, not have any other experiences. But start to think about who you can use as a reference now. And this could be people that you've worked with. This could be instructors. It could be other nurses that you've potentially worked with, either in clinical or at, one of your positions that you've held. Always ask permission before using somebody as a reference. And so you want to specifically ask them, can I use them? And it's right here. ask them if you can use them as a positive reference. Okay. Don't ever assume, okay, this is a big thing. Don't ever assume that somebody is going to give you a positive reference. That is something that you need to remember, because even though you think somebody, may be giving you, or you've worked with, just don't assume, always ask. If they say yes, you can use them. You can use them as a reference. Make sure that you get the information that you need. So their name, their title, their address, their work address, their work telephone number, their email address. This way, when your future employer asks you for references, that you have the information. And in some cases, you can ask for people to write a letter of reference, okay, or a letter of recommendation. And in some cases, you can even draft a letter for them to use. So those are options as well. But, I would, as, either from an instructor, whether it's classroom or clinical, ask for a letter of recommendation that you can keep on keep on file, so that if somebody does ask for one, then you have it readily available. Job hunting. So and it's interesting how we've heard about this nursing shortage, right, for so many years, and it is still going to be, significant. But how do you find a job, unless, you are already working and you kind of have an idea. But some of the things that you can do, of course, family and friends that have nursing contacts, they may be some, good way to find jobs. Placement personnel are also good sources. This is like your workforce centers, or Fortis actually has, they have career services that can assist you, right, in helping you find a position. They also will help you write your resume if you don't have a resume, to get that ready for you to turn in. Job fairs. And I don't know, like, I know different areas have different things, but like, I know workforce development, and even some of your hospital systems will advertise that they're having job fairs. And you can go and fill out applications and do on-spot interviews all at the same time. So that might be a chance for you to do it, or to, find employment. Social media sites, uh, things like LinkedIn, Indeed, are some common, sorry, excuse me, are some common sites. Just, I don't know if anybody has a LinkedIn account or Indeed account. But you can make you make your connections. You can look at others' networks, you can reach out for suggestions. There's a lot of training, there's education, and LinkedIn has a lot of things on there that are beneficial. Indeed is another one. You can look for jobs that are, within your local area. There's also things like Simply Hired, which is another site. I'm trying to think, there's a couple of them out there that, may also provide some insight as to open opportunities for you. It can be a little overwhelming to use some of these sites, especially if you've not used them before. Some of the tips when you're using any of these, either the social media or the professional sites, Don't add, this is a big one. Don't add your current employer or your supervisor to your current or to your network of contacts. Be very selective about adding coworkers. Um, don't add anybody unless you know who they are. Um, never, this is just a general statement, but don't post opinions about your employers. Don't put negative context about your employment or your employers. Um, just be very careful what you post. Um, don't let anybody else post on your walls. Don't, post, hey, I'm looking to quit my job. Anybody hiring, that kind of thing. Your current employer may still be able to find that information. You may not, you may lose your position that you have without having another position. Um, and so just be careful. And I know that everybody, and I'm sure everybody has heard and seen lately some of the nurses that have lost their jobs or have posted not so positive things about patients um, on Facebook and Instagram. So again, be very, very careful with what you post on social media. I've actually had like filled out applications and they've actually you like in some of them you can't even move forward with the application unless you've posted your LinkedIn information, your Facebook information, because they are going to go and they're going to look at those things to see what kind of information you post or what you post on your social media sites. So just something to think about. Um, and then the resumes and the application process. So who has a resume? Everybody has a resume. All right. So resumes. So what's some information about your resume that is important to note? How long should your resume be?
No more than
One
two
page.
pages.
Right? One page is best, right? You want to try to get as much information about you on that one page, right? Why? Why do you think, 2-page max, and I'll go to the next one. So it's a 2-page max. Why do you think 2 pages is the max?
Because they're not gonna want to read all that. It's too much.
It is, right? It can be a lot, especially for, somebody that has, changed jobs every few years, even if it's within the same organization, right? So that's one of the benefits of working like in a big hospital system, right? Maybe I want to do 2 years on med surg, and then I'm going to go 2 years on oncology and a couple of years here, right? But you're going to list those all on your resume instead of just all one. So 2-page max. You don't want any longer than that. You always want to make sure that you're using good paper. Use white or off-white. You don't want to use any designs, textures. Your cover letter, your paper, your envelope should all match, right? You don't want to use a whole lot of different colors. Making sure that you're using the appropriate font. So Arial Times New Roman 10 to 14 font is preferred. You don't want to do underlining in italics or any kind of graphics. Bolding is okay, like if you want to bold like your job titles and things like that so that they stand out a little bit, that's okay. Um, you don't want a whole lot of columns. You don't want a landscape. You don't want to use any of the designer fonts. I will tell you, prettier is not always better. More standard is something that, we look for. If your resume is too busy, that can be very distracting as well. So you may not, of just, it's always better to be a little bit more plain than flashy. Let's put it that way. Make sure you use spell check. I can tell you, I've seen many resumes where there's been spelling and grammar errors, and that's just not very professional. So always make sure that you're using the spell check, your grammar check. Have somebody proofread it for you, is also another way. Um, you can print them out, or you can also and then always type them up and save them, so that you can, potentially use them for electronic submissions, like through Indeed, or even sometimes LinkedIn, having your resume available, right, to send to a future employer, possible employer. Don't fax your resume unless it's requested, that you fax it. Make sure you have balanced space. Again, you don't want it to be overly busy. You sometimes putting bullets, rather than paragraphs underneath your job experience, that allows for some of those skills to stand out a little bit better, so that you're not just reading a standard, job description. You also want to emphasize your strengths. Either, even if you have a limited work history, make sure that you're emphasizing your strengths. Even like before I went to nursing school, well, I was in the military right before, but my growing up, my mom owned a bar in New York, in Brooklyn. And so I spent, time, I was a bartender, I was a waitress, right? So those, some of the skills there, right? Your what is it? Your customer service skills, right? Those are really good skills to have, right, in healthcare. So emphasize your strengths, when you are filling out that resume. And then, of course, we need to prepare for the interview itself. And how many people like to go on job interviews? What are some, I'm going to stop sharing. So, whoops, what are some questions they ask you in job interviews?
Strengths and weaknesses. What you learn about your company.
What makes
Why
you
did
a
you
good
choose this
candidate for this
company?
job?
Yeah.
Yep. What are your
What are
strengths
some of
and
your
weaknesses?
weaknesses?
Say that one more time.
What are some of your weaknesses?
Yeah. What are your strengths and your weaknesses? What do you know about the organization that you're applying for? Somebody else said something else and I can't remember what it was, right? So those are some of the questions. Most of us have the hardest time with name 3 of your strengths and 3 of your weaknesses, right? We, don't always want to talk about our weaknesses, right? But identifying our weaknesses is actually a strength if you think about it, right? Knowing what your weaknesses are, helps you to get better, right? And improve. There's also, illegal questions that can be asked. And so, things like, have you been hospitalized within the past 5 years? Why that would be a question that they would want to know, right? Don't understand why. But a good answer for that is I don't have any health problems that would interfere with fulfilling the described position. If they've asked if you've ever been on workers' compensation, you can either answer not applicable, or you can say I'm able to perform all of the described job duties. If they ask you if you have a criminal record, okay, this is something you need to be honest and very factual about this. Any organization that is going to hire you as a nurse is going to do a background check. When you graduate from nursing school, prior to you taking your NCLEX, they are going to do a national background check. All right, so on your Board of Nursing application, they are going to ask this information, and you should be open and factual with that information. I have seen people have to go before they even get licensed, have to go before the Board of Nursing and explain why they did not put certain things on their Board of Nursing application, so just be very open and factual with it. Um, whatever the background is. Doesn't necessarily mean that you're not going to get hired, all right? But if they ask that question, you need to provide answers. So another thing that is going to be really important for you as you get ready to interview, you know, I always went with, a copy of my resume, a copy of my nurse's license, and my CPR card as well. And then depends on where I was going. I'd also bring a copy of my shot record because, sometimes they want that information as well. So have that information readily available so that if they ask you for a copy of it, even though you're submitting your resume usually online or you've already submitted it, always bring a copy because you just never know what happens. Maybe their printer's not working, whatever. This way they can kind of have a copy of your resume right there in front of you. We know that the purpose is they're going to ask you a whole bunch of questions, but it is also important for you to have questions to ask them. And why is that important? Having questions to ask them shows that you are more, it shows that you're interested. And it shows that you have taken the time, excuse me, to do a little bit of research or that you're taking the time to learn more about the organization. So what are some questions that you can ask during your interview? What are some questions that you would want answers to?
Okay.
Okay, the pay. Let's not start off with that though.
You
Okay.
want to ask them why it would be good for you to work for their company. What do they have to offer? Like, how
Okay.
is a normal work day in that particular office?
Okay. What's a normal workday? Okay. What else would we want to know?
The turnover rate, how is morale, how is the training, what's to be expected?
Okay. What else? If you're going to be a brand new nurse,
The
you're going to
patient
go
to
with
nurse ratio.
the nurse to patient ratio. Yes. What else?
Going in as a brand new nurse, you would want to know what is it that they do for new nurses? Like, how can I be of a good asset to your team?
Okay. What's the orientation process?
Yes.
There you go, right? What's the orientation process? What's the support? What's the
How do
mentoring
you guys support
process?
your nurses?
Say that again.
How do you guys support your nurses?
How do you support your nurses? Absolutely. Um, what type of clients are you going to work with? You know, what's the general type of clients? How many hours are your shifts? Are they 8-hour shifts? Are they 12-hour shifts? Am I working 5 days a week? Am I working 3 days a week? Like what hours am I working? Is there a float rotation? That's a big one for a lot of people, right? How often are you going to get floated to another unit? I worked for a company, we had 7 long-term care facilities. And so they would sometimes float you to a whole different facility, right? So what's the float rotation? And sometimes you didn't know, you would get to work and they'd be like, hey, we need to go here and work here. And so usually they would have, if somebody didn't have transportation, they would actually have, provide transportation to go to that other facility. So it's just, these are some things that you would need to know. Do you have overtime available? Or do you have mandated overtime? So think about some facilities, a lot of, like, especially some of your state facilities, some of your federal facilities, they may have mandated overtime. All right. And so if you have kids and other responsibilities, right, that's something that you need to know, right? If I go in for my 8-hour shift, am I going to be there for 8 hours or am I going to be there for, 12 or 16 hours? What's the weekend schedule? Right? A lot of facilities may be every other weekend, every third weekend. Is there any kind of a competency testing? So some facilities may require you to take a dosage calculations exam prior to being hired so that they know that you know how to do that. And some facilities during the orientation process, you'll go through a skills fair. You also may go through some simulation training as well. So these are things that you kind of want to ask. Nurse to client ratios, I know somebody mentioned that too. It's huge, right? How many clients am I going to take care of? Is it 4? Is it 6? Is it 8? Or in a long-term care facility, right? Is it 12? Is it 30? Is it 50? Is it 60? Right? How many people am I going to be responsible? Also want to know, is it a new position or are you replacing somebody? If you are replacing somebody, you can ask, why did they leave? If it's a new, you can say, why was the position added? Other things, is there an on-call requirement? Trying to think what else. Is there an annual or review based bonuses or increases in pay? Is there any opportunities for career advancement or even educational opportunities? Like, will they pay for a percentage of you to go back to school to get your RN, your BSN, whichever? Trying to think of what else, right? So these are all kind of things that you want to take, you want to have questions. At the same time, you also want to do research about the organization that you are interviewing with, right? So when they ask you why you want to work here, you have a good question, or a good answer for that. And we know when we're going in for that interview, that first impression is key, right? First impressions, initial impression is made within 30 seconds. So when you go for that interview, right, you want to make sure that good hygiene, that your hair is arranged appropriately. Um, be modest with your makeup. Um, for guys, making sure their hair, their mustaches, beards are neatly trimmed if they have them. Keep your nails short, clean, nicely manicured. You don't want to go in with your fake nails that are 3 inches long. Um, and I will say, I know that we make you, have no nails in nursing school. And I know some of the things that you may see out in clinicals may be a little bit different, but most organizations do have rules regarding fake nails. They're not normally allowed. However, they may not enforce it. So, but normally they're not allowed. Um, if you're a smoker, don't smoke before you go in for your interview. You don't want to smell like tobacco smoke. Um, don't use a whole bunch of perfumes, body sprays. Make sure that you brush your teeth before going in. And then, of course, just making sure that you when you with your clothing, that you're neat and clean, that you are ironed. You don't want to go in and look all wrinkled in a hot mess. Be careful with wearing scrubs to interviews as well, even though it is a healthcare industry. Some kind of take that as, you know, I don't know, unprofessional in a way. You can always ask if scrubs are appropriate for the interview, but generally speaking, I would avoid it. Um, Trying to think of what else. Be careful with your jewelry as well. Simple jewelry, you don't want a whole lot of, danglies from your ears. Be careful with some of your facial piercings as well, your tattoos. Of course, tattoos now aren't as big a deal within practice as they used to be. But your jewelry definitely is. So just be very careful with that. Um, Trying to think, when you go in, make sure that you stand tall, you sit erect in the chair. You don't want to just kind of slouch down in the chair. Um, you want to just be very assured, very positive when you go in. A couple of just other little things. Arrive a few minutes early. Turn your cell phone off or, leave it in the car. Um, Putting it on mute is still going to vibrate. So you don't want any distractions during the interview. Nice firm handshake. Always introduce yourself. Um, and just like I said, just be very assured, don't go in and be, very demure. You want to be as, you know, hold yourself up high. There also may be some other pre-employment things that you may have to do. Pre-employment physicals, drug screening, background checks. Those usually, you'll get that conditional job offer. And then you'll get the firm offer after that physical exam, the drug screening, the background checks all come back. So this is another one too. If you're on certain medications, you want to make sure that you disclose those if they run the potential for coming up on your drug screening. So always get either a note from your doctor, a copy of your prescription, to show some of those. And again, don't lie on your background checks. Make sure you fill it out appropriately. And then once you've done the interview, follow up is essential. All right. So this is a big thing, and not a lot of people do this. So it is really something that you need to kind of think about. Um, Once you complete your interview, you want to follow up with that person that has done your interview. So write a handwritten thank you note that you can mail, or you can send an email thanking them for the interview. You kind of want to do that the same day. So if your interview is at 10 a.m., once your interview is done, you get home, sit down and send them an email and say thank you for taking their time. Doesn't have to be a whole dissertation, just telling them thank you for taking the time to interview with you. And then, give them an idea that, hey, after speaking with you and about the position and the job duties and the responsibilities, I really think that I'm a good match for this position and that you're still very interested in that job. At the same time, you want to give them a time that you're going to follow up with them. So give them a couple of days. They still may be interviewing for the position, and then let them know that you will follow up with them on that specific day. And then on that specific day, remember to follow up with them. And that kind of just, again, it shows that you're still interested in the position, and you're kind of waiting for that feedback back from them. The last part of that too is if you are interviewing for a job and you already have a current position, all right, be careful on how you resign from your current position. Um, you always want to leave on a positive note, and that is very important. Okay. So it is common practice to give at least 2 weeks notice when you resign from a position, whether or not it is written policy. Just walking in and saying, hey, I don't want to be here anymore, and walking out isn't a good way to leave a job. So you always want to try to be as professional as possible. Hey, just, thank you for the wonderful opportunity that I've had here for the last however long you've been there. I appreciate everything that they have, that you've done, the experience that I've gained. You don't have to really say anything else, and just tell them that, this, my last day will be on such and such a day. Oops, my apologies. Um, but always trying to give notice that looks better on you. It looks, and people do, the when they do their reference check, you can know that you left on good standing. All right, so let's go ahead and take a break. I notice everybody needs to take a break. So let's see, be back at 4:20. Mm. All right.
Martinez.
Yes.
Hey, what you have in the announcements for exam 3, is that basically what the exam review is going to be over?
Yes.
Okay, thank you.
You're welcome. All right. So any questions on week 7 material? Yesenia, did you have a question?
No.
Okay, I can't see you.
I'm sorry.
All right. Whitney, Mamaka, Sheree, are you guys there?
I'm here.
All right. All right, so we'll go to chapter 8. So chapter 8 is nursing theory, research and evidence-based practice. So why do we have nursing theories? Anybody know why we have nursing theories? So there's a lot of theorists. There's a lot of nursing theorists out there, and there's a lot of theories that have been developed specifically for nursing. Um, and a lot of, what is it? They provide a basis for research on the effectiveness of nursing care. Some theories are even the basis for curriculum development. So when we, establish the nursing curriculum, we can use theories as a basis from there. And there are 3 concepts that are important to nursing. The person, right? The person is the recipient of care. So our clients that we're working with, health is the goal of nursing, right? Is to try to restore health or minimize the effects of disease processes, get them back to, either their previous level of functioning or a higher level of functioning. And then the environment, and the environment is the setting where nursing care takes place, right? So that could be whether it's in a facility, a clinic, or even in somebody's home. And so why is it important that we talk about nursing theories? And when for those of you that are going to go on to get your RN, your BSN, nursing theory is going to play an even bigger part because you will study even more of these nursing theories. In their, like I said, they're a framework for nursing education as well as clinical practice. So, as a practical nurse, you may also be asked to gather data for research, which, just gathering that data and giving that data to somebody. I don't know if anybody has thought about working in research. There's a lot of research opportunities, whether it's with like clinical trials, and things like that. So, who was the first nursing theorist? Anybody? Who was the first nursing theorist?
Was it Freud?
Freud. Freud was a
Florence
nursing.
Nightingale.
Florence Nightingale. Freud, he was a psychoanalyst, right? But Florence Nightingale, right? She's, everything for nursing, right? She was the first one to emphasize the environment, right? Ventilation, warmth, noise, light, cleanliness. Right? She was the one that was like, hey, if we wash our hands in between working with people, right, we may help to prevent spread of disease. And so she was our first nursing theorist. So she was the first to collect data and use evidence to make clinical decisions. So, things like when she worked with the soldiers, that, when the environment was warm, clean, and well lit, minimal noise, right? We had a decreased death for of those soldiers. So she is super important. We all should know who Florence Nightingale was. We also know who Abraham Maslow is. So who is Abraham Maslow? What is so important about him?
Created the hierarchy of basic human needs.
Right. He created that hierarchy of basic human needs. So he is a psychologist, and he had his human needs theory. And we know that we use him quite often in nursing. His theory states that certain internal, external, physical, as well as psychological needs are common to all people. And he arranged those in that nice little hierarchy for us. If there is an unmet need, that creates tension, and that is going to motivate the person to react to meet the need, right? So if I don't have housing, right, that's going to create tension, and it's going to motivate me to try to find a safe place to stay. When needs are met, the person is no longer aware of the need, right? And so that need is not going to motivate them anymore, right? So if I find safe place to live, right, I can check that off my list, and I don't have the motivation to continue to find a safe place to stay. Dominant needs that matter to a person can vary in life, right? What's important to you as a younger person may not be as important to you as you get older, right? So needs can vary, right? Throughout our lives. So when we look at what are our basic needs according to Maslow, what are those basic needs? What are at the bottom of the pyramid? What's at the bottom of the pyramid?
Psychosocial.
Okay, or psychosocial, like what? Give me psychosocial is not, it's
Airway, breathing, circulation.
physiological. There you go.
Yeah.
Yep. So, right, your physiological needs: oxygen, water, food, elimination, safety, sleep, activity, mental stimulation, right? Those are at the bottom. Those are our basic needs. So when a patient comes into the hospital, to the long-term care facility, wherever it is, right? Those are the basic needs that we need to provide for them. And then after those basic needs, then we attend to their safety needs, security, freedom from harm, protection, right? How do we keep our clients safe? And so that once we meet their basic physiologic needs, then their safety needs. Those are the two biggest concerns, right? That we as nurses, need to focus on. And then we move up, right, to love and belonging, esteem, and self-actualization, which is your highest level. So now let's discuss some of the individual, not all, but some of the individual theories. So I'll share my screen on the PowerPoint. So Dorothea Orum's self-care deficit theory. This is actually one of my favorite theories, but it consists of three sub-theories: self-care deficit, and the nursing system. So self-care, okay, this is a goal that's directed towards a safer environment for life, health, and well-being. All right, so ideally, people learn to respond to their health cues in themselves, or the environment as a way to maintain personal health. And then we have a self-care deficit. Personal care does not meet therapeutic self self-care demands, right? So this individual doesn't recognize or know what to do in regards to personal health situations. So basically what this means is that somebody that comes into our care, they're usually again in some sort of a health crisis. There is something going on. So they have a self-care deficit, right? They are not sure what to do in regards to that disease or that injury. And so that results in that self-care deficit. The nursing system, the nurse empowers the client through their relationship to meet their self-care demands. So nursing responds to the person's care needs totally, partially, or in a supportive role according to the need of the client. So any client that comes in is going to have some sort of a self-care deficit, and working with the client, right? That is how we are going to help to meet their self-care demands. And so we're, it's even boils down to how, when we're writing our nursing care plan, how are we going to choose the interventions that have the desired outcome for our clients, right, during that nursing process. So it's an interesting, nice, that was one of the first theories that I learned about when I was in school, other than Nightingale. Then we have Madeline Leninger. So Madeline Leninger's is cultural care theory. And so hers is, basically how we take care of people or respond to people of different cultures. So she identified two kinds of care in every culture, generic and professional care. So generic is things like your home remedies that are used in care. So think of some of your cultures, right, that may use some of those home remedies and want to incorporate those into their plan of care. And then professional care is, right, that's provided by healthcare providers that are specifically trained to provide care. And if you think about it, we all practice both of these, right? When we don't feel good, what are some things that we do at home, right? That maybe we learned growing up, or, it could be even self-treating, right? Like, taking some ibuprofen, eating some chicken soup, right? Could be very simple like that. And then when we can't manage the symptoms anymore, right, we go to the doctor, and then the doctor can assist and provide additional care. There's also 3 modes that guide decisions when providing care according to Leninger. So cultural care, preservation, or maintenance, right? So we talked about providing culturally competent care to our clients, right? This is helping them or assisting them to maintain their care values, to maintain health, or restore health, right? So this could be incorporating some of their cultural practices, right, in their care. Cultural care accommodations or negotiations. And so this is something too that I talked about, right? We can allow them or encourage a lot of their cultural care, as long as it's not going to be a danger or pose a threat to their health. And then cultural care repattering or restructuring. This is taking some of those negative or potentially dangerous pattern or, cultural practices, and providing that education about that, and then finding a way to make it more of a positive experience. And so that is how, this all part of that culturally competent care that we have talked about previously. Hildegard Peplau is her interpersonal relations theory. And this is how we, this is our basis for developing that therapeutic relationship with the client. Knowing that there are parameters, right? And it's very important for us to develop that therapeutic relationship. There's 4 overlapping phases of her interpersonal theory or interpersonal relations theory. We have the orientation, and this is where the client seeks assistance because of a felt need. So they've identified some sort of a problem, and the nurse works with the client to help them recognize the problem. And then we have identification. And during this phase is where the client understands the situation and responds to the nurse who is offering help. Exploitation, this is where the client begins to depend on the nurse, utilizes the help that's offered. And then in resolution, this is where their therapeutic relation comes to an end because now the client is able to care for themselves and no longer needs the assistance of the nurse. So orientation, right? We identify the problem, and identification is that client understands the situation, is responding to assistance. Exploitation is where the client depends on the nurse. And then resolution is when we are back to a normal state and that dependent behavior is no longer there. Rosenstock's health belief theory. This theory tries to explain why a person will or won't take action to prevent or detect illness. So we've talked about this, right? Even with some of our culturally competent care, or even in, thinking about different clients and different people that we will work with. Some people don't have the ability to have or don't have access to healthcare, or don't have access to culturally competent care, or don't believe in even preventative or other measures, right, related to care. So this was, why are people don't take action? Perceptions vary. They may even have no basis in reality, which is something that could happen. Beliefs are often connected to existing barriers, right? So this is, some of those, why won't people get, some of the preventative measures to prevent disease, or even some of the screening measures, right? To check for the presence of disease. The last one is a cue to action is seen as necessary. And so, this is where they finally are like, okay, maybe I do need to, go to the doctor, get my vaccinations or get my screening tests done. And this process can also be used within with the nursing process, again, so that we can encourage them, for some of those primary and secondary prevention measures. Sister Calista Roy, Roy's adaptation model. This describes the client as a holistic adaptive system. There's both internal and external stimuli that affect the system. And so there's different types of stimuli. So your focal stimuli is something direct. So like a client experiencing pain. It could be contextual, meaning that other factors affect the focal stimuli. So being examined in the area of pain. And then residual is both the internal and external factors that may not always be evident, like so memory of past pain an effect it had on the client. So example of this, who here has had a child, has given birth?
I have.
Okay. Who here has more than one kid? All right. So, and then this is just, sorry, Kevin, this, but it's just something that, can think about. I'm gonna stop sharing for 1 second. So when we look at like, you may not remember something, who, so we, especially if you've had more than one child, right? Um, how long did it take for the memory of the pain to go away? Took a few months, right? But then when you kind of forget about it, right? You don't remember the pain from one child to the next, do you? The intensity, right? So it's that kind of thing, right? So they may not always remember the pain and the effect that it had on the client. And so it's, especially something repeated like that. Like I will just use myself as an example when I had my fourth. Um, it was about 5 years after I had my youngest daughter. So it was I was a surprise. We'll just put it that way. A good surprise, but still a surprise. Um, and I remember he had to have an eviction notice, so I had to go in and I had to get induced because he decided that he wanted to maintain permanent residency. And so I start to go into, they started the induction and we're waiting and waiting for something to happen. And so they had asked if I wanted an epidural, and I was like, no. I was like, I'll be fine. And I hadn't had an epidural with any of my other kids either. So, I mean, but this would have been the perfect one to try with. And so of course I go into active labor and I'm sweating and it hurts. And I looked at my husband and I was like, and I said I didn't want an epidural. Why? And he said, because you said it didn't hurt that bad. And I'm like, so you don't remember things, right? Until they happen again. And then you're like, oh my gosh. And I should have known because all my kids were over 9 pounds. So I should have just, said, yes, give me the epidural and all the other pain medicine that you could possibly give me. But that's something sometimes we just don't remember. And that could play a huge part in it. Coping mechanisms as well was something that, Sister Calista Roy took into consideration with her adaptation model. Um, and the coping methods were known as regulator and co-regulator methods, so, or subsystems. So regulator is the internal effects that take place into response what is happening internally. So that's the neural part, the chemical, the endocrine processes, right? That's, of course, our, homeostatic mechanisms that go into play to try to regulate our system when there's something that's trying to negatively affect it. The co the cognator subsystem is the learning, the processing, the judging, the emotion that the client used to cope with what has happened. So whether it's an illness, whether it's an injury, whether it's a trauma, or even if it's something exciting or happy like childbirth, right? It's all of that process that is going into the coping of that event. Um, and then the adaptive part of that is, how, what are the self concepts related to the aspect, the physiological, the psychological, the spiritual aspects of the client, and how are we to help them? Another big theory that you may hear a lot about or have heard a lot about is Jean Watson's, and that's her theory of human care. And according to her human care theory, health is a harmony between the body, the mind, and the spirit. It also involves self-perception and how the self is experienced. So illness would be a lack of harmony within the self and the soul. And the nursing role is the caring process in order to help that client to regain harmony and health. So through through the caring, right, of the nurse to the client, that encourages self-knowledge as well as self-healing within that client. And so those are just a few of the nursing theories. Like you learned about Patricia Benner's novice to expert theory, right? When you wrote your professional development paper. Trying to think of who else um would be out there. There's a lot of nursing theories out there. So like that same link that you use, that current nursing link that linked you to Patricia Benner's. If you're interested in nursing theory, you can go to nursingtheory.org there, and it lists all of your nursing theorists and an overview of each one of those theories. Some of them are interesting. Some of them, you may not understand how to apply them to practice. Some of them are going to be more educational based, right? There's also like adult learning theories and things like that are going to be out there. But looking at the theories, and everybody has heard the wonderful term evidence-based practice. But what is so important about evidence-based practice? Why do we need evidence-based practice?
It proves that the applied methods are actually working for the care that you're providing.
Right. It shows like this is why we're doing what we're doing, and right, it tells us that basic information, right? So why do we do why is a Foley catheter insertion a sterile procedure, right? Why is trach suctioning sterile, but trach care is non-sterile? Or trying to think of turning and repositioning and hand washing. There's, all of this is evidence-based. It's things that have been proven to be safe and effective and provide the best care for our clients. And nursing research, I will tell you, I love reading other people's research. I don't like to do research, and it's just one of those things. But nursing research, it supports existing knowledge. It develops new knowledge based on observation and experimentation. It helps us to identify specific nursing interventions that are proven effective, right? So that helps to, ensure that we're doing the right thing. It also, research helps to generate knowledge for clinical practice, for nursing education, as well as the delivery of nursing services. So like I said, nurses at all levels are encouraged to participate in research, in varying degrees and varying levels. And so there are a couple different types of nursing, or not just nursing, but there's a couple of different types of research studies that are out there. So I'll go back to sharing. Maybe I can hit the right button would be even better. There we go. So a quantitative research study. So quantitative research study is an objective study. All right. It uses a variable that we are trying to measure. And there's two types. We have one variable receiving the intervention, and the other is one that doesn't receive the intervention. So example, let's say we are doing a study on the effects of a new blood pressure medication. Let's just say that, okay? We're going to split our group into two groups, and we're going to give, let's say we give one group of clients the new medication, And then the other group of clients is going to get the same medication that's been out on the market for years. Okay. And then we are going to observe and we are going to measure and collect the data for each group to see how they do. And it's more we're collecting numerical data, and so we can examine the relationship, like which group did better, which medication does better. We can look at the cause and effect for each of those. We also can do randomized control trials. That is the recommended type of quantitative research that we do. And there's different types of controlled trials that we can perform under your quantitative. It just depends on what we're looking for and the answers that we want to get. On the other side of that, so with quantitative, we can get some, concrete data. Okay. With qualitative research study, this is more subjective. All right. So think about the difference between subjective and objective information. With quantitative, it's objective, right? So it's tangible. I can measure it, right? With subjective, it's not, it's subjective. It's interviewing clients. It's, listening to their stories. It's getting their experiences. So, somebody that has chronic pain, right, we can't really quantify that, and everybody's experience with that is going to be different, right? It's a subjective experience. Phenomenology is a type of a qualitative study. And this is what we I'm trying to think. A case study that examines the lived experience of high school students who are both gifted and ADHD, right? So it's just still a qualitative, it's still a subjective study. There's also, grounded theory studies and other theories that would fall under your qualitative studies. But again, it's more subjective. So quantitative is your objective, your qualitative is your subjective studies. Which brings us to their wonderful evidence-based practice. And so we've talked about evidence-based practice, but Dr. Archie Cochrane, he was a British epidemiologist. He challenged the public to pay only for medical care that was proven to be effective, and he advocated for the use of randomized controlled trials as a means of reliably informing healthcare practice. And so the Cochrane collaboration was established in 1993, and it was a collection of evidence-based healthcare interventions obtained by a systematic review of research. All right. So he was the one that said, hey, if it's not proven to be effective, let's not do it. Don't do it. Right. So he was the one that kind of started this. In 1999, the Institute of Medicine issued the report to Air is Human. Has anybody heard of that before? The Air is Human report. So this was a landmark study that they did. It discussed the evidence of medical errors in healthcare and the need for reform. And it outlined a lot of scary stuff, like the numbers of people that died as a result of mistakes, I guess would be the word, in healthcare, whether it was medication, whether it was wrong site surgeries. So it was a pretty landmark study, pretty big landmark study. In 2001, the Institute of Medicine issued the Crossing the Equality Chasm, which called for consistent high quality healthcare. for all people. That included that clients should receive care based on based on the best available scientific knowledge. And so during the last 2 decades, insurance companies began to pay for healthcare practices only if their effectiveness is supported by evidence or scientific evidence. So that is pretty significant. And then during the last decade, hospitals are actually denied payment when complications in a Medicare client develop if evidence-based guidelines are not followed. So that is to think about, and I think I've talked about this too. It's about quality of care, right? Not quantity of care, right? You providing the highest quality of care is better than the quantity of care, especially when working with your clients, and making sure that they are using those evidence-based guidelines. And one thing that is a lot different now as we, working with clients, more people are, increasing their health literacy by, doing their own research, whether it's through, one of the, the CDC or the IOM, or like things like WebMD, but they are going out and they're doing their own research to increase their own health literacy as to know what best practices are. So, elements of evidence-based practice: best research evidence, the clinical experience, as well as the client's preferences. And so when we think of evidence, evidence-based practice, it's always about what the research says. So what is the best way to do that procedure? What is the best treatment options? What's the best medication, whatever it is, and then your clinical expertise and client preferences. So we're always going to think about our client when we are implementing care, right? Whether it's something they want, something that they don't want, or, how do we incorporate, their preferences into their plan of care? So with that, so the nurse's role, and I'll stop sharing. So when we talk about going in, we talk about research and how nurses play a role in that. There's different doctorate degrees. There's the research doctorate, which is like your PhD. They design and implement research studies. They publish their findings. There's the DNP, which is the Doctor of Nursing Practice, which is a practice doctorate. They review research and look for more evidence-based protocols to implement in clinical practice. At the master's level, there are, they can do research questions. They can also look at the effects of evidence-based solutions on nursing problems. Bachelor's degree level, they can, critique public research, and of course, they're going to use evidence-based practice. Your associate degree diploma nurses, they are there to offer new insights to improve quality of care. And then as practical nurses, right, you can also question the basis for nursing actions by considering research evidence as well as tradition and client preference. So how do we do all this? So think about this. You guys, as future nurses, as current students, all right, you have all this wonderful knowledge that you have gained throughout your nursing program. You have gone into your clinical sites. You have seen how some things are done. And as the newer generation of nursing going in, you can raise questions. You can, think through some of the things that you do and say, hey, I think we can do it better if we do it this way. Um, and so, that's when you can get on the internet or you can go to the hospital library and do research on what some of that evidence-based practice is and maybe find a better way to do something that's going on with your organization. And so I have met previously with hiring managers at the hospitals, and I've always asked that question because some students or some transitioning practitioners from student to practice. Some are shy and some are more, kind of laid back and don't want to be, in the limelight, so to speak. But others are very assertive, and may, actually look to try to change practice or to make things better. And so you have that opportunity. Hospitals encourage that behavior, especially in their nursing staff, because we're the ones that are working with the equipment, we're working with our clients. And so it may actually, lead to something that may be beneficial for nursing as a whole, or even the organization. So looking at those policies, looking at those procedures, identifying ways to maybe make things better, work better, even improve practices within the organization generally is something that is encouraged as new nurses, because you guys have new eyes. That's the best way to look at it. It's new eyes coming into a situation, and that you may make it better for somebody else later on. So always have that questioning attitude. Ask why. I think of like the little, what is it? I forget what age it is. Is it 2 or 3 where they just start asking why all the time, right? As new nurses, it's kind of like your job, right? To ask why. Why are we doing it this way? Why do we do it that way? Why? And maybe at some point you'll be the one saying we can do it this way better, and here's how we can do it that way. All right. So I was trying to think. So we did chapter 17, or we did week 8, we did week 7. So let's do something different today. Give me 1 second to pull it up. All right, so looking at your exam 3 concepts. All right. Tell me, what are some of the basic resume requirements, for lack of a better word?
For it to be on white or what did you call it? Neutral color,
Off-white.
Yeah,
off-white
off-white
paper.
paper. It needs
Okay.
to be on resume paper, something a little heavier.
Okay, very good. So quality paper, white or off-white, right? No designs, no textures, things like that. What else?
Spell check.
Spell check, absolutely. How long should it be?
2 pages.
2 pages
No,
minimum,
yeah,
2 pages maximum, right? 1
yeah.
page is
maximum.
preferred.
Yeah.
Okay. Um, Make sure that doesn't look cluttered, right? Or junky. Okay.
About a 10. Is it 10 to 12 or 10 to 14 font?
10 to 14.
10 to 14 font,
10
and
to
use
14.
bullet points to highlight the important areas.
Yep. Use your bullet points to highlight those important areas. Very good. what are some things that we should do to prepare for our interview?
Write down questions to ask the employer and do your research on the company that you're interviewing for.
Very good. Write down some questions to ask when you go for your interview. Right? It's very good. What else?
Make sure not to wear scrubs.
Okay. I okay, make sure not to wear scrubs. Make sure you're dressed appropriately. Absolutely.
Not a lot of heavy makeup.
Okay, not a lot of heavy makeup.
And
This wasn't
minimal
on there,
jewelry.
but I think I want a tour of the facility. Like I want to see how many residents that the nurses have on the floor, how many call lights are going off, are the aides doing their job? Like I want to see how the facility flows before I
Okay.
commit myself to something.
That's a really good point, Ebony. A lot of people don't think about that. And that is something that a lot of places will offer you, but you may have to ask it as well. And so asking them, like they may not pay you for it. I'm going to tell you that they may not pay you for it, but you can ask if you can come in for a shift or a half a shift to kind of see what the flow of the unit is. That's a really good point, Ebony.
Yeah, because I work in like the rehab centers now as a medication aide, and I feel like I kind of got tricked with like having 30 or 40 residents. And I'm like, oh no. Like, so I just want to see how everything flows from now on.
That's a really good point. That is, and not every facility will do that, but I think if you ask, you might you might be able to do that. That's a really good point. You know what, that I totally agree with that. So that is something that you may have the option to do. Um, be prepared to answer questions. So, I mean, we talked about some of the questions that they may ask, like, what are your strengths and weaknesses? I think one questions that everybody hates to answer is when somebody says, "Tell me about yourself." Right? Where do you want me to start? Do you want me to start the day I was born, or do you want me to start with just my nursing experience? Like, kind of what do you want to know? And that's okay to ask. I mean, you can ask them like, do you want me to talk about my work history or do you want me to talk about my personal life? And that's okay to ask because they may want a little bit of both. Um, they also may ask you, why do you want to work here? And I feel like that's a trick question sometimes, right? Um,
Because I need the money.
yeah, but you don't want to say that, right? I mean, you can maybe in an indirect manner. But this is something that, this is where your research into the organization. Maybe it's not your first choice job, okay? Maybe it's, the job that you really want isn't available yet, and you're trying to find something to like get you through, right? Um, still do research and kind of identify some of the highlights and how that might fit into what your goals are and kind of use that. Um, why did you leave your last position? Why should, I hire you versus, somebody else? Of course, your strengths and weaknesses. Those are horrible. I hate answering those types of questions. Um, how do you work under pressure? You know, um, they may even ask you what your salary what your salary requirements are. How do you deal with criticism? That's another one too. Or, how do you deal with excuse me, how do you deal with irate patients or upset family members. So there's so many different questions that you can prepare for, and you can Google to even asking, what kind of questions that they ask during interviews. Um, Always follow up after the interview, right? So send an email, a thank you card, something. Also saying that, hey, like, thank you for taking the time to meet with me or interviewing me today, to discuss the position. I've enjoyed our conversation. I'm very interested in the position. And I will follow up with you on a specific day, to see if you've made a decision about hiring or whatever. So always follow up after the interview. People that don't follow up, sometimes it looks like you're just not interested in the position, so it's always good to follow up. We also talked about networking. Networking is another thing that we talked about. So, you know, um, whether it's, using your family members, using the job boards, what else did we? Indeed, the job boards, I closed the PowerPoint. What are some ways that you can use networking to advance within your own organization? Excuse me.
Like getting different classes, like continuing educations,
Okay, continuing education and
certifications.
services. Certifications, absolutely. How do certifications help? What are some certifications that you can get as an LPN?
An IV specialist or
Care.
Wound care.
mhm.
There's the long-term care certification too, for those that are interested. Okay. There's we talked about the long-term care, the IV, the gerontological, the wound care, right? Those are some of your certification opportunities. What about professional organizations? I didn't talk about professional organizations. So some of the organizations that you can join as LPNs, the NLN, which is the National League of Nursing, that's open to all level of nursing. NAPNES, right? That is your LPN. We also have the NALPN, which is the policy making for LPN. So if you want to join professional organizations, there are some open for you. I would also look into it if you want to join. Some of them actually offer discounts while you're still a student. Once you're out into practice, those student discounts don't apply anymore. But there's in-service, there's workshops, there's your CEUs, there's podcasts. So always look for those opportunities to continue to grow in practice. One thing that I did not talk about, and I don't know how I missed this, is once you were hired, it was Ebony. Ebony, you were talking about going in and kind of getting the feel for the unit and seeing how the workflow is. The NCSBN, which is the National Council the National Council of State Boards of Nursing, developed a transition to practice model. And this was developed by them to help new grads, whether they were RNs or LPNs, transition from their education programs into practice. And we know that that transition process can be difficult for many. The goal was to increase retention, improve client outcomes. And it's kind of like a residency program, so to speak. But basically what it is there's a preceptor that's there to assist the new grads start to apply theory to practice, develop their clinical reasoning skills, improve safety, and decrease practice errors in the care of clients. And so there's online modules that are part of this transition to practice model. It's communication and teamwork, it's client-centered care, evidence-based practice, quality improvement, and informatics. And so some organizations have, implemented this into their process for, onboarding new nurses. But your orientation process is super important. And so looking at not just how the unit flows, but what the orientation process is. How many of you currently work in healthcare? I know from reading your professional development papers that a lot of you have been in healthcare for long periods of time. Who has not been in healthcare? And then I know there's a few that have not been in healthcare as well. So having a really good orientation process is really key for anybody as you transition into practice. Because it's not just about can you pass medications, right? Or, take a blood pressure. It's really building those clinical reasoning and critical thinking skills, and learning and policy and procedure, and what to do when. Each facility is going to be different. And so whereas I agree 100%, like with what Ebony says, is go in and kind of get a feel for the environment that you're going to work with, because it might be your dream job to go work at this such and such a place or this such and such facility. But then you go in, right, and you start to meet some of the people, and you might realize that that's not the place that you really want to work. So I really like that you said that. And I've only had that opportunity, I think, twice in my career, where I've gotten to actually go in and kind of see the workflow of the unit prior to be accepting a position. So I really like the fact that you brought that up. But that is something I would, consider a very strong suit or a really strong point if they allow you to come in and do that. Oh, my little sheet's closed. What's the difference between quantitative and qualitative research study? So what's a quantitative research study?
Quantitative is objective study.
Very good. Quantitative is objective and
And qualitative is subjective.
Very good. Very good. What else? Let's see. Trying to see let's see. What, tell me about Maslow.
Maslow focuses on the airway, breathing, circulation, then safety, shelter. Well, it's the safety, shelter, and all of that in one, and then they go to safety. I mean,
Right. So the first one's your physiological needs, right? That is the bottom of sorry. That is the bottom of the pyramid, right? Making sure that we meet those basic physiological needs, and then we go into the safety, right? And that second level of Maslow. And we know as nurses, right, we primarily focus on the bottom two, right? So your physiologic and your safety needs. All right. We missed a theory. I missed a theorist. Did I miss this theorist? I don't know why. I feel like we missed Rosenstock's. So Erwin
We
Rosenstock
missed
developed.
Rosenstock.
Yeah, that's what I just realized. I apologize. So Rosenstock's health belief theory tries to explain why or why not a person will take action to prevent or detect illness. So I feel like we did it. Maybe, I don't know. Perceptions vary. They may not have no basis in reality. Um, their beliefs are connected to existing barriers. So they may see that preventative care treatment is expensive, it's inconvenient, or it may be painful. So when we look at that, right, if we can, show that there's more positive than there is negative, then they may be more inclined to participate in those preventative measures. And then acute action is seen as necessary. I feel like I talked about this, but maybe I didn't. Um, something, has encouraged them, whether it's looking at the TV or, even getting a reminder call from the doctor's office. So when we look at Rosenstock, so think about this. So when we think about our population that doesn't have or has limited access to healthcare, or maybe lives in some of the lower socioeconomic areas, or doesn't have the health literacy. How many of you watch TV? Okay. How many of you listen to the radio? Right? So think about how widespread those things are. And so when we look at acute action, we've seen an increase in commercials regarding hypertension, diabetes. What's the other one? Oh my gosh, I was like, oh wow, I can't believe they actually finally did that, and I cannot remember what it is. Um, but it's targeting certain populations and certain diseases. And the more we put that information out in the public's eye, right, people may start to think, oh, wait, I fit in that certain population. Maybe I should go checked out, right? So the more contact we have, the more information that we provide, it may encourage people to go get the care that they need. Does that make sense? Right? That's why some of those commercials are out there. I cannot remember which one it was. I was like, that is really good. I don't remember if it was, shoot, not to Google the commercial because now I can't remember. I know it's an actor that does the commercial. Oh my gosh. Anyway, I can't remember. Sorry. I will at some point. I'll probably wake up in the middle of the night going, that's the commercial I was talking about. Leninger's cultural care theory. She was, how do we, accommodate with cultural care, right? Allowing them to use some of their cultural care processes, right? And during their care, making sure that it is safe, as well as providing a protective environment. your PEPLA's interpersonal relations theory, right? That's how we develop our, our therapeutic relationship with our clients and the phases of that, your orientation, identification, exploitation, and resolution. What else? We talked about evidence-based. What's evidence-based practice?
Scientific.
Best practice.
Say that one more time. You broke up, that's why. No, okay. Right, so evidence-based practice. What are the 3 areas of evidence-based practice? Anybody? The research evidence, the clinical experience, right, and clients' preferences. Those are, it's a nice little triangle that all falls in with that evidence-based practice. And then lastly, one last question. What is the spirit of inquiry?
It's like being willing to ask more questions, to get more information, being, inquisitive or whatever.
Right. Asking why, right? Why? Why do we do it this way? Is there a better way to do it? Right? Always ask those questions, right? We tell nursing students, have a questioning attitude, right? Don't always just accept it for what it is. Why are we doing the things that we're doing and how we're doing them, and how is it having an effect on our clients? All right, so recap before y'all leave. We do not have class next week, okay? So happy Thanksgiving. I hope everybody has a very safe and wonderful holiday. Enjoy the couple days off. Try to get some rest. And I will see you the following Friday. All right? So be blessed. Y'all have a great day.
You
You
too.
too.
Have a
Good
good
night.
night.
Happy
Thank you.
Thanksgiving.
Thank
Happy
you.
holiday.
Happy
Thank you.
holidays.
Thank you.
Happy holidays.
Thank you.